All right, welcome to the May Board of Health meeting. We're glad you're here. There'll be questions later for the public, but I'd like to call this board meeting to order. The first order of business is approvals. We have quite a few approvals this time. The first is the minutes that Kim has faithfully prepared. May I have a motion for their approval?
Ken Edwards, so moved. Second.
Okay, so Dr. Edwards approved. Is there any discussion? Or I need a second, I guess. Joe, you were in the process of doing that. You want to second it?
Okay.
So, we're off to a good start. Any discussion of the minutes? All those in favor?
Aye.
Opposed? Motion carried. All right. So Jennifer or Jen, we have some vouchers here. Do you have any surprises for us? Welcome to the staff. We'll welcome you formally later, but any curveballs here? Nope, you're on mute.
There we go. I don't believe that there's anything unusual in what we've seen in the past, so no surprises or anything.
Okay. All right. So you have the vouchers in front of you. May I have a motion for their approval?
So moved.
Okay, Dr. McBride approved. Is there a second?
Ray will second.
Ray will second. Okay. Any discussion? All those in favor?
Aye.
Aye.
Opposed? Motion carried. Thank you. That's we didn't have these. We didn't have a report last month, so we're glad, very glad to have a report. Thank you so much. All right, moving on to the extensive resolutions. Nikki or Courtney?
Yes, I'll go ahead and get us going here. So, I mean, after a few months of not having many resolutions, here they all are. It just seems like it rains or it pours. So this first one is the third amendment to the comprehensive agreement from Michigan Department of Health and Human Services. There have been some increases to programs, as well as some adjustments for some funding that in reductions that we knew were coming, but the contract is finally catching up with that. So we have an increase of a little over $10,000 for WIC, increase of nearly $50,000 for the HIV linkage to care. And we do expect that that will continue into future fiscal years because there are some additional services the state wishes for us to offer. So we're coming up with plans for that. Our emergency preparedness program got an increase of $32,000, and I believe some of that has to do with just timing. And then our Michigan Adolescent Pregnancy and Parenting program saw a reduction of $22,000. No, it was an increase of $22,000. Courtney, it was an increase of $22,000, but there was a reduction of about $29,000 in the Michigan Health and Wellness 4x4 grant. We knew that that was coming. We do have a staff person who still continues to be partially funded under that, and we've made adjustments to the grant budget to with that accommodation. So that means that our updated comprehensive agreement is now at $5,841,000. So that's certainly larger than the average year. A lot of that is because the COVID funding has come through this comprehensive agreement as well. But this is our third amendment.
Just if it's the pleasure of the board, or if there are any questions, I'd like to take all of the amendments at once, unless you have something that you're concerned about.
Okay. I will keep going unless I hear from you all. So our second resolution is regarding the Baton Harbor Farmers Market, and we have received a small award of funding from the United Way of Southwest Michigan through Be Healthy Marion to be able to operate the market. So this resolution is to accept $2,880 for operation of the farmers market this summer. Our next resolution is has to do with our 4x4 grant. A lot of that Michigan Health and Wellness 4x4 grant, it has to do with improving access to trails, improving healthy eating environments. And a lot of that is done with partners that are doing some work. So we do have some agreements. This is similar to what we've had in previous years of this grant program. But we do have a few contracts here that the next couple of resolutions are regarding. This first one, 214, is a contract agreement with the city of Niles. And the city of Niles is an implementation partner on launching a historic bike route throughout the city of Niles. So it's another amenity in the community that encourages physical activity, has mutual benefit for some local economic stimulation as well. So we will be paying them $600 for work that they will be doing from June through August. And that the contract total is, I'm sorry, Jillian, you can chime in with the details here. We've got the $600 payment this summer, and then there's a total of $1,200 from May 1st to September 30th. Jillian, is that tracking for you?
Yes, the contract total is $1,200. I think we have it split up into payments, so
Thank you.
it's written that way in the resolution, which is a little confusing, but.
All
This
right,
is
and
a bit
go
of a
ahead.
squirrel. I'm curious with the historic role of Niles. I understand it was a stopping point in the Underground Railroad. And I wonder if that's, I mean, this may be too much getting into the weeds, but is that something that's highlighted in the historic tour?
I believe it is, Peg, and we'd be more than happy to provide you with a listing. There are, I believe, 16 different historical markers that are along this route that was designed in partnership with the Historical Center there in Niles. So we could absolutely come and present to you more about each of those sites and the historical nature and the history behind them. But I do believe that there was one that is just honoring and kind of remembering the importance of Niles and the Underground Railroad.
I don't know whether we're going to be able to meet live in July, but it would sure be neat to have something that would honor Niles, you know, talk about Niles that time. So, but it's up to you. I don't know what's coming at us for the board. So, thank you.
We'll take that into consideration. So the next resolution.
I have a question. Can I ask?
Yeah.
Is this a self-guided tour? Is this a led tour? How in depth? I mean, is it just this Niles was a spot on the Underground Railroad or what?
Nikki, do you want me to provide a little bit more detail? Yeah, so it is a self-guided tour. And so for the last couple of years of the 4x4 project, that was part of the initial work that was done was identifying these historical sites, marking out the route that we will have. And this year, what the city will help us do is create a map and a self-guide that can be procured along in different places along the route so that folks know where to go and what they're looking at along the way.
How long is this route? What I mean, if we're talking about health, how you know, what's the length of the trail for walking and?
Yep. So I believe it's between 8 and 9 miles of route. And there are certainly some areas that are more apt for walking versus biking, but it was originally supposed to be a bike route.
Gotcha. Okay. All right. Thank you.
All right. So next resolution 215 is also part of the 4x4 grant. This is a contract total of $24,000 to the Southwest Michigan Planning Commission. This is a continuation of work that they have been doing in conjunction with Be Healthy Marion and many other stakeholders for the expansion of the Indiana-Michigan River Valley Trail from Niles to Berrien Springs. So significant work has been underway and that is within the scope of this grant. The resolution 217 is a grant application to the Kresge Foundation. And this is an opportunity that has been made available to individuals and health departments that were part of the Emerging Leaders in Public Health fellowship, and that Courtney and I participated in a couple of years ago. So the Kresge Foundation has a pot of money that they wish to disseminate to local health departments in order to increase equity in the COVID-19 response. So we have worked through a plan to try to engage a lot deeper into our community as we move beyond vaccine motivated individuals and into those people that might be more vaccine convenient in their thinking, or the swayable portion of the vaccine hesitant. In really trying to use community leaders, whether they have a formal title or not, but people who have influence in communities, to help share accurate information, stories, the why behind vaccination, to really help dig deeper into those pockets of the population. We have this at a varying capacity in communities throughout our county. We have a relationship that has been fostered alongside Spectrum Health Lakeland with some community influencers in the city of Benton Harbor, the greater Benton Harbor area. However, we want to be able to replicate that type of model in other parts of our county, because there are many communities where we are seeing lower than desired vaccination rates. And we know that we're embarking on a next season of really trying to dig much deeper beneath that level of people that are vaccine motivated. So this grant application is a request for $50,000 for a 1-year project. We expect to be done by the end of December. All things go well, but we desire to apply for that funding. The next resolution 218 is very similar in that it is a grant opportunity from the Michigan Health Endowment Fund. It is also a grant application for $50,000. And it is to another arm of outreach and communication and relationship building with all the nooks and crannies of our Marion County population. So whereas the last resolution I talked about was really to try to fund some a program of vaccine ambassadors and people to influence, we, with the Michigan Health Endowment Fund, are seeking to work with a community-based organization that will help really canvass communities and have an effort that's similar to what you see when groups are trying to get people to register to vote or fill out the census. As we saw last year, there's a lot of community canvassing and just really blanketing of messages in communities as well. So this Michigan Health Endowment Fund grant is for local health departments to partner with a community-based organization to do that type of outreach. So we're requesting $50,000 for that application as well. If we are awarded both, I think that would really leverage, they would leverage each other, and we'd see outstanding results from both. If we only get one, I think our plans are scalable enough that we can make that work. And we've already engaged multiple partners to be able to help with this work. So we will be moving forward with a version of that strategy regardless, but the funding will absolutely help accelerate the work.
Thank you for not offering cash incentives.
It gets tricky, short-term, long-term.
I know, but why should people get paid when other people haven't? I mean, it just makes no sense to me. I don't, let me put it this way, I don't agree with it, but I also haven't raised kids in the past 30 years, which that seems to be kind of the parenting mode. But anyway, but I think your approach is really spot on, and I think it'll be very effective. So,
do you anticipate reaching out to faith leaders if you got one or both grants?
Absolutely. I mean, I think that's an important piece of the fabric of our communities.
Mm-hmm.
So, okay, next resolution. Last one, the resolution 220. This is actually a proclamation that has come to us, and I don't see Commissioner Commissioner Harrison maybe could help with this, but this is a proclamation regarding Michigan Public Health Week. And this is a resolution to declare Public Health Week in Marion County next week, May 9th through the 15th.
This came from the Michigan Association of Counties. So they're trying to get all the counties to pass this resolution recognizing the efforts of all our health departments.
I see also the resolution for Dr. J. Would you like that taken separately, or
Yeah,
how would you?
maybe that would be good to take separately.
Okay. So you have in front of you a number of resolutions that Nikki went through. May I have a motion for approval? Vanessa, how about you? Okay, so Vanessa, come off mute, please.
So moved. I'm
So
sorry.
moved. Okay, great. May I have a support?
Second.
Okay, thanks, Ken. So all in favor? Or any
Aye.
discussion, I should say, any discussion, sorry. Okay, all in favor?
Aye.
Opposed? Motion carried. So we also have a resolution for Dr. J. Oh, my heavens.
Yes, it's very hard to believe that this is the last board meeting with Dr. Johansson as our medical director. We do have a resolution, and I know it was sent to you electronically, but I just want you all to see that to fit it on paper, we've got it on 11 by 17 piece of paper. I think Jillian put it best: for a larger than life medical director, we needed a larger than life resolution to be able to just honor and acknowledge the impact that Dr. Johansson has had at this department, and really just a lot of the passion and some of the fun he brought to the work as well, and to the workplace. So I don't know, Peg, if you want to read the resolution. This is customary, I believe.
All right, I'd be glad to. Whereas Dr. J has dedicated much of his professional career to the Marion County Health Department and the people of Marion County for more than 44 years. Wow. Lengthy career began in 1977 when he was deputy medical officer, then interim medical director, and ultimately assumed the role of medical director in June 2014. In addition to serving as medical director, Dr. Johansson has served as the medical examiner from 2014 to 2018, president of the Michigan Association of Public Health and Preventative Medicine Physicians, 2007 to 2010, and from 2008 until 2013 was assigned to the Governor's Task Force on Child Abuse and Neglect. He's also made significant contributions to the health and well-being of residents in Marion County, spearheading collaborative community groups to tackle public health issues such as lead poisoning, prohibiting smoking, educating leaders and legislators on health inequities, and pushing a pro-health public health agenda. He's been bold and discerning, it's certainly true, in recent health crises. I just want to thank you, Dr. J, on the coronavirus. It's been just a myriad of things coming down at us, and you've been able to help us think through that. It's just been really confusing to know what to do, but you've charted a clear course. So for our local health department, I mean, one of the things is keeping the schools open. You've had your hand on that. Just really, really appreciated that. So for decade-long public health career. So it's resolved that the Marion County Board of Health give you our sincere and grateful appreciation for what you've done. So thank you so much, Dr. J. As as Jillian put it on a big board, we can't get all of that on. So thank you.
Thank you very much.
Yeah.
Working with this board has been great. We've had great boards, and I actually started being the medical director in '99. So there is one little error on there, but what the heck?
Okay. All right.
Yeah.
Well,
So that's when Dr. Silvernail retired. So yeah, it's been a pleasure serving. To say it's been rewarding would be a complete understatement. It's a very rewarding job, and because there's so many varying and different things to do that affect a lot of people. So, you know, the health officer I've worked with, you guys, the staff, the opportunities you provided as a board of health, you listened and wherever possible got us the tools to be able to do the things we needed to do. And one other thing we need to correct in there is we always had, the mantra was that we were not banning smoking. We always said it in a positive light. We were for a smoke-free environment. And so that was one of the things that helped us get that through. So you might want to change that one too, but wherever. But yeah, but thank you very, very much. I can't say how great it's been. And I leave with, I'm going to miss this a lot, then I'll be doing some public health work probably overseas, but at 73 and a half, it is probably time to move on. It is hard.
Yeah, we can appreciate that. So I'd like someone to support this resolution with two changes. One, that Dr. J became the medical director in 1999 and smoke-free environment.
Yeah.
Okay. May I have
That'd be big.
So move.
Okay, Linda has supported. Any discussion? Joe, are you speaking to us? If you would unmute. Joe, if you're talking to us, would you unmute, please?
Yeah, I didn't know how I got muted. Yeah, I just, will miss him as well. I think his sense of humor and his perspective that he gives us at each of our meetings is just priceless. And I'd at least like to second the motion since it's already been made.
Okay. Ken, do you have a perspective?
Yeah, I think it's such a privilege to see the embodiment of an extraordinary ethical physician who has brought so many of his gifts to our community to enhance not just his individual patient interactions, but the entire health of a community. He has worked tirelessly. I have gained tremendous knowledge from my friendship and relationship with Rick Johansson, and feel very privileged to have known him.
It's been incredible to have worked with Dr. Johansson. I remember he actually used my office at Andrews to take tests, and my secretary supervised, I think, his MPH exams. So his impact on this community, from his individual patients to the public health, to the fact that we can breathe free in every restaurant and public place in Marion County, has been incredible. So it's been a pleasure and honor. We'll really miss you and hope to see you around in many other places.
Mm-hmm. Oh, thank you all for those comments. Thank you, Dr. J. All those in favor of the resolution?
Aye.
Aye.
All right. Nobody better oppose, but I guess I have to say oppose.
Thank you very much, every one of you.
Thank you.
And if
Thank
I
you,
could just
sir.
pile on just a little bit here. I think one of the things that as the Board of Health that you don't always see either is just the influence that Dr. J has on the state, across the state, not necessarily on the state health department exclusively, but he has been very involved in MAP and other work groups. And Dr. J is his ability to be able to look at the data and quickly analyze and decide this is going to be a really good path forward, here's why, and to synthesize a lot of different research while also balancing public health needs of a community. It's really a phenomenal gift. It has been an asset to our state. I know it has influenced a lot of other medical directors and health officers in some really positive ways. So that doesn't always become apparent here, but his reach has been far beyond just Marion County in his role as the Marion County medical director. So I can't say it enough, but we are definitely going to miss Dr. Johansson, but are happy for him in whatever comes next in these next seasons of your life. Thank you, Dr. J.
All right. Well, thanks much for the words. So we have a new business manager. Yay. So would you like to introduce Jen?
Yes, I'm very pleased to be able to introduce Jennifer Kelly Priest as our new business manager. She started with us, it's been about 6 weeks now, I believe. So this is just an interesting time to transition into a health department. And so she's definitely learning a lot and really applying a lot of what she knows and bringing a great fresh perspective to us. So Jen, if you'd like to just talk a little bit about your background and how you came here briefly. And you're muted. There we go.
Thank you, Nikki. As Nikki mentioned, so my name is Jen, and I have been a lifelong resident for Marion County. And I originally, my first part of my career was spent in corporate finance with Whirlpool for about 20 years. And after that, I decided that I would like to work more towards supporting nonprofits or public health and schools and that sort of thing. So I decided to venture into the world of social work and went back to school again to receive an MSW. So I think this role really complements my financial stewardship and my passion for helping others. So that's my goal of what I'm looking to bring to the table. I have 2 kids that are in the local public schools, and I'm very excited to be a part of the team here.
Great. Welcome. Really glad to have you. So thank you. We always hold our breath when we have job openings. So get somebody good in. So. And Brian, 20 years. You want to turn on your camera so we can take joy in those 20 years, Brian Murphy?
How you doing? Yes. Well, I tried turning on the camera, but I don't see my face. Can you hear me?
We can hear you, but we can't see you.
Well, you know what I look like. Oh, wait, I got it. Hold on. Yes. So thank you for recognizing my years of service. Started all the way back in 2001 and been in the food inspection business for quite a while, most of those years. And it's very rewarding. It's been very rewarding. Recently got the supervisor's position, and that was good because that got me out of that food inspection bubble and got exposed to different, facets of the EH, and it just made me more of a diverse employee here. So, and I'm very blessed and fortunate to work here at the health department. Amazing staff, supporting staff, not only in EH, but the whole department. Everyone, it's just great work environment. Don't want to sound sappy, but I wouldn't want any other job. Very rewarding what we do for public health. And I know COVID lately has been just, taking over, a lot of schedules more than others, but, I just saw how that, how we all came together with this vaccine thing, how we all work together. So it's been great. So, yeah, very fortunate. I want to continue getting better and serving the department and serving public health.
Great. Nikki or Nick, do you want to add about Brian? We really appreciate him.
Yeah.
I'll let Nick go first.
Oh,
I want you to go first.
sorry. So I can't get my camera to work either, so I apologize for that. But it's technical difficulties. What can I say? But no, it's been great having Brian. I was fortunate to be here when Brian actually did his internship, and I think we remember Brian going out to do beach samples. So I think I mesmerized him with that part of our job. That I have to give credit to Brian's brother-in-law too. I think he also did a good job. He's also a registered sanitarian doing environmental health work. So between his brother-in-law and I'd like to think myself with the beaches, we kind of mesmerized Brian to working in public health and environmental health. But it's been great having Brian as a supervisor too. For I think it was about 3.5, 4 years ago that he became the supervisor and for environmental health, and before that he was the team leader and standardized trainer for the food service program. He did an amazing job. We went through a lot of changes with the state rules and guidelines and the way that we were supposed to be doing inspections and in restaurants and everything. And I'd like to think that he did an amazing job with all our staff and teaching them constantly. And to his credit, I'd like to think that he was a huge part in playing a role in the fact that for the first time in all the accreditation cycles, we met all the requirements, all the indicators for the food service program. So I think it was cycle number 6, which they are 3-year cycles. So in our history, it made everybody feel incredibly great about it. So, and Brian has been great as far as all the different challenges and adapting to the changes and always keeping a very calm demeanor about him, which sometimes very much compliments me. A little bit on the opposite side of that. So it's been great. I love having Brian here at the health department, and hopefully he'll have another however many years he wants to. So.
And I'll just add, I mean, Brian has risen to every challenge. He is willing to do new things. If there's just something that's needed and he can do it, he's more than happy to do it. And he does it with a very pleasant disposition. And we just really appreciate that. So Brian, thank you very much for your years of service.
Oh, thank you.
Linda, do you have a comment?
Yeah, from the perspective of someone who has received his services with 11, 12 sites now in 3 counties. Brian's really been very helpful, and his team been really helpful at teaching and expanding and enhancing the capacity of our site managers in understanding. Not only they understand the need for it, but in understanding sort of why things happen as they happen. And I think that helps them, that they're not just doing something to do something. They understand why they're doing it, why it works within a whole system. So he's really been great in as somebody who has gone through inspection after inspection, year after year after year. So we appreciate him, and we are very grateful to have him.
Great. Thank you, Linda.
Yeah, thanks much. All right, moving on to the financial statement that you have before you or on your screen. Jen, would you like to walk us through that, please?
Absolutely. So let me pull that back up. All righty. So what we're looking at this time, our year to date, we actually have 220,000 in additional funding opportunities that you'll see. Approximately half of that came from the Medicaid Title 19 reimbursement. And then we had several other sources that were available to us that we had not planned for. With regarding our expenditures, we are running approximately 385,000 lower than planned. So that's good news. We're seeing about 166,000 related to salaries and wages and 153 favorability related to fringe and benefits cost. So that puts us in grand total $606,000 favorable to our year-to-date budget. And then you would also see, if we wanted to compare that to last year, we're over $500,000 favorable to where we were at the time last year.
So just trying to get some nuances on this, it always concerns me if we're down on staff and benefits, just staff. And this is not your fault, Jen, by any means, or anybody's, but we don't have much. I mean, we're running really lean, and I really worry about the staff during these COVID times. Do you have anything you want to say about that, Nikki or Courtney?
So we don't have as many vacancies as you might expect right now. So there are a couple of positions that we either have posted and are looking for, and I think we have one or two that maybe have not been posted because we're trying to rework what that looks like post-COVID as well, and trying to prepare for that future state. I think that this is certainly a time to be quite concerned about our staff's hours and how much they're working. At the same time, some of the budget assumptions do budget for the most conservative scenario in terms of fringe benefits, and it's sometimes we're budgeted at a position that somebody who has been here for years was at the top grade or the top step, and when we hire somebody, they start at a lower step. So there are some of those differences there that are not necessarily because we've got an overburden on the staff, but because we may have people that started at a little bit lower of a salary and did not take family health insurance. We always budget assuming highest fringe costs, and that's not always how it plays out. So definitely appreciate that concern, and we always work to pay attention to that, as well as through some other markers here as well. But I don't believe that that is what is driving that 300,000 being under budget on salary and fringe exclusively.
Thank you. Mm-hmm. All right. Any other reflections or comments on the budget report? Well, thanks very much, Jen. We really appreciate it. Thanks for understanding what's going on.
Thank you.
All right. Moving on to the administrative reports.
Yeah, so we are going to, if I can share my screen here, going to just do a little bit of a walkthrough with some of the data that you're accustomed to seeing each month to get started. A lot has changed in the last month since we talked about where we were here as a whole group, and a lot has changed in the state of Michigan. Starting with our epidemic curve here, we're very grateful. When we last met, we were around this top plateau, not knowing if that was going to be a plateau or if that was going to be a continued increase in the number of cases. So we have seen over the last 2 to 3 weeks significant decreases in the number of cases that we're seeing. We are now averaging around the mid-30s in terms of number of new cases per day that are reported to the health department. Those are levels that make us feel more comfortable, I suppose, is one way to put that. We're able to definitely do meaningful case investigation, contact tracing at that level. And it's variable with knowing that our nursing staff is also split with vaccination, and then we have case investigation happening too. So we're at not only from a workload standpoint at a manageable level, but these are transmission rates that I think are to be expected with a virus that has been with us so prevalent, and we're doing a lot of testing and looking for those cases. So we're pleased to see this trend. Now that we are on this downward side, it's easier to do a little bit of analysis of what happened. We know that as the state of Michigan was increasing throughout March, and that was the national news story on many outlets for a long period of time of, Michigan surging and what's going on. throughout many communities, this curve went much higher and at a steeper rate. We are fortunate, I can't exactly tell you why necessarily we were slower and lower. I do believe that, and I think it's very plausible that the fact that we had such high vaccination rates of our most vulnerable populations by mid-February, and then that continued to grow over those intervening weeks here as well. By protecting that population, I think we really did lower the amount of cases that are out there. We'll never be able to prove that, but I think that that was important work that we did. When we look at the trend for percent positivity, this is a 6-month view. So this is going way back to November when we were at our highest. We have definitely seen a decrease in the percent positivity, and mathematically you expect that. You have fewer cases, you expect the percent positivity to go down. And then when we just look at the amount of testing that's done, it's been relatively flat. So we didn't see a huge increase in the demand for testing at the same time that we had our increase in cases, but demand hasn't really dropped off now either. We just have pretty steady demand for testing. Marion County does remain one of the higher testing per capita, tested per capita counties we have throughout the course of the pandemic. We have lots of locations that are still doing testing. So that is a good piece of our public health system here locally. Now, when we look at hospital numbers here, we have also seen through the month of April a pretty steady decline in the number of people that are hospitalized with a positive COVID test. That peaked right around high 40s, maybe hit 50 as that average, but it has come down rather abruptly as well. So we're very pleased to see that that was a very short stint here at these higher numbers. We anticipate that based on what we're seeing with case trends, that these numbers will tend to come down or continue coming down. And then with death trends, we really just have not, here in 2021, fortunately, we have not seen as many deaths. And I, again, attribute a lot of this to the fact that we have been very effective at getting our vaccine out, and we have administered vaccine at very high rates to people that are most likely to die or be hospitalized, particularly those over the age of 65. We've got great coverage. We're over 70% in those categories. So in those age groups, so we're very pleased with that. We're glad we're not seeing the death trend, really spiking or going up. So we're pleased there. Shifting gears to look at vaccination coverage a little bit now, just to give you an idea, this vaccination coverage thing is going to become a really big deal as we continue to move through. The state of Michigan has 50.4% of the state that has initiated vaccination, while Marion County is at 46.3. The denominator here is people 16 years and older. That's who is approved for vaccines. That will not always be the case, but right now it's at 16 plus. So for many months, really through most of April or up until about mid-April, Marion County did have a rate that was higher than the state of Michigan. And I think that was because we were very well organized, got ourselves out of the gate. We're able to leverage some great relationships with community partners to bring vaccine to people that were eligible at that time in January, February, March. We've definitely seen a slowdown in vaccine demand. And so the rate at which we were administering doses as a county in the month of April slowed significantly compared to the previous months. And I do believe there were others in the state that were still catching up and working through some of that initial vaccine motivated group that is still eager to get vaccine. Slowdown is happening across the state as well in terms of demand. When we look at Marion County specifically, just in terms of number of doses administered to Marion County residents, the amount of doses administered is probably in the county is probably higher, because I know for sure we at the health department had been seeing at some points, maybe 20% of our vaccine clinics were from people not residing in our county, but perhaps working here. This data is all based on county of residence. But so there have been over 100,000 doses of vaccine that have been administered to Marion County residents, and that represents 57,000 people who have received a first dose. So that would include a first dose of a two-shot series like Moderna or Pfizer, or Johnson & Johnson as well. So these vaccination rates are becoming increasingly important for the public to track and what they're trying to watch and keep an eye on because of the My Vac to Normal challenge. And this is something that the governor released last week, really outlining here is a path towards how we back ourselves out of epidemic orders and some of the mitigation measures that are in place. So last week, as of April 29th, there were 48.8% of Michigan residents vaccinated. We saw in one of my previous slides that it's now at about 50.6%. So it's moved 2 percentage points up. Once the state as a whole hits 55%, and then 2 weeks later, because we want people, once we hit that rate, we need 2 weeks for those people to have full immunity or full benefit of their first dose. That is when the epidemic orders requiring employers to do remote work whenever possible or feasible, that requirement will be lifted. So easing out of that requirement. Then once the state hits 60% vaccinated, first dose, that's when a lot of indoor capacities will be raised, and there will be more opportunities for people to gather indoors at different type of facilities. And there will also no longer be a curfew on restaurants and bars, because right now they have specific times they have to close. Once we hit 65%, it will lift indoor percentage capacity limits. So it will be whatever you can fit while maintaining social distancing. And there will be relaxation of residential requirements as well. And then once we hit 70, barring any other factors out there, there is an expectation that there will be a lifting of the gathering and mask epidemic orders or face mask orders, so that there are just not policies in place requiring these broad mitigation strategies, because there should be coverage. The caveats we've all been told and have heard, all of this is also dependent on making sure our hospitalization data and our death data and the circulation of variants, and if variants remain well covered by current vaccine, all of those things need to be in place and in alignment, driving in this direction as well. We as a staff, and I think as residents too, are pleased to see what the thinking is, what some of the thresholds are, and how we actually start to back out of some of the things we've put into place. It's easy to start to put some public health measures in place in the beginning, but charting that path out can sometimes be difficult. So I'm glad there is something here to start working with. I'm going to, I think I said this, but these percentages are based on the whole state, not county by county. So if Marion County gets to 70%, while the rest of the state average is 60, great, we're helping contribute to those state numbers, but we would still be at whatever step the whole state is. That there is not at this point in time a regional or county by county approach to implementing or backing off of these epidemic orders. And then the last thing, just to kind of talk about, there are ongoing issues and considerations and things that we could probably talk about for a long time, but there's definitely just been a complete shift in vaccine supply and demand. I believe when we last met, that was before, or it was just after the vaccination had been made open and available to the general public very clearly in that manner. So really, we have not seen a huge run on demand. There's also just a lot more supply. There's a lot more vaccine availability. There's ample supply of Moderna, Pfizer, and Johnson & Johnson. So people have the ability to kind of choose their product, choose their provider. There's lots of places to go. But this is leading to a little bit of a shift, as we talked about with some of the resolutions, in our outreach and communication efforts. I don't remember if I've talked with the board about this before, but we're trying to think of engagement with our population of people along a spectrum of vaccine acceptance. So we have people who are vaccine motivated, those are the people that were on our wait list, that were checking our website very frequently, that whenever they could get an appointment, they went and they got their vaccine. And if they found another appointment even sooner, they took that one. They were motivated to get that vaccine. And then at the far end of that spectrum, you have people who absolutely will not be vaccinated, and there's nothing that can be done to change their mind. But there's a whole lot of space on that continuum between those groups. And we have fully saturated our vaccine motivated population, at least those that are eligible age-wise for the vaccine right now. And then there's this vaccine convenient group. Those are people that they're willing to get it, but they're not going to go out of their way to get it. So if it comes to them, if somebody in their life helps push them to it, if they don't have to make an appointment, they can just kind of walk in and it's in a convenient location and it kind of fits into their day that day, they'd be more than happy to get the vaccine. They're just not going to go out of their way for it. So that's a total shift. With the vaccine motivated, we built it and people came. With the vaccine convenient, we are even more so trying to go to where people are and where they're gathering. And I do believe that there is a group of people who are truly vaccine hesitant, where they would be potentially willing to get the vaccine. They need more information. They want to see how other people are faring and just more time to pass to see if there are other side effects of the vaccine that pop up. I think that's a concern people have, or they just really want to understand a little bit more about it. So we are definitely shifting our communication, our outreach, and how we're planning vaccine clinics to be able to accommodate different parts of that spectrum beyond just the vaccine motivated. We talked a little bit about epidemic orders. There have been some updates, even yesterday evening, some came out that were shifting some of the outdoor gathering sizes and those sorts of things. So we're seeing that as more vaccination is happening and as we're getting to warmer weather, which there's a little bit of protection from how people are gathering during those months, those are continuing to shift. And then as you can imagine, we are working very closely with schools and all sorts of other organizations as we work to determine how school year-end events like proms and graduations can happen, as well as many other community events that happen throughout the summer. So the team has been doing a phenomenal job providing some technical assistance. There have been other county partners from the prosecutor's office and the sheriff's department that have been working to make sure that we are doing everything we can to maximize the economic stimulus and social benefits of having events, while also reducing COVID risk and working within epidemic orders, not necessarily knowing exactly what those are going to look like beyond May, but really trying to balance all of those things. So I'm going to stop there. I'm happy to take any questions.
I have like three, if I could answer that question. One would be compliance with the regs. I notice as I'm out and about that compliance is sort of iffy or mixed. So I don't see a high level, I don't see a low level, but I see it kind of mixed. The other is, and we had our vaccinations, if you will, in Florida, and there is a number of snowbirds that got it down there, and there's people maybe went to Indiana, maybe for work, or they could, yeah, I don't know. Does that, then I was wondering if that gets counted in Marion statistics or even Michigan statistics. And then I guess the third would be, it seems like air travel, are requiring it or may. Colleges seem to, and so young people will have to get it. They'll be required if they're going to go to college. And then there's, and then I don't really know this, but are companies going to require it, like Whirlpool, if they can go back into the work setting, will they require it? I know I asked last time about the hospitals, if they require it, like we think we do with flu shot. And there was a question whether, since it's an experimental or whatever we call that, emergency, I guess, that you can't require them, although some are, certainly colleges are. So I'm just wondering what the status of that is, or if you even have a sense of where that's going. Anyway, Shut up.
Yeah. So with the issue of compliance, I will say that we had predicted that we were going to be in this really messy spot where we still need mitigation measures in place and we still have epidemic orders, but we have a large percentage of people that are vaccinated and don't want to comply with them anymore because they're tired and feel like they're low risk. So they're kind of making some of that decision. And I think there also are people who are just tired and unvaccinated and don't want to comply and choose to make that decision as well. So I think that my observation, and I don't go out a whole lot. I go to the health department and the grocery store at home. So my empirical observation is not best, but it does seem to me, and when we're talking with community members, it does seem to me we have good compliance compared to some of our other colleagues across the state. And there are a lot of other counties where nobody's wearing a mask. Lots of big events are happening, these sorts of things. I do think that compliance is going fairly well here in Marion County. We wouldn't expect it to be 100%. It hasn't been at 100%, I'm sure, at any point in the pandemic. But I do hope people continue to understand that compliance with these rules and these mitigation strategies can really help foster that culture where everybody else is doing it too, and that can help slow spread. With the out-of-state vaccines, if somebody does have an out-of-state vaccine, we're working through exactly what that process might be. We've even had requests from people who've they live here, but spent some time abroad and actually were vaccinated abroad and want to get a locally issued vaccination card. So I definitely think that that's something that people are going to start paying more attention to, because one, they want to make sure they contribute to those percentages that we're tracking, but two, just to make sure they have the right paperwork. I know at the state level too, there are efforts to increase sharing. Currently, immunization systems across states don't really talk to each other. That's why in Marion County, it's always been childhood vaccinations. Our rates always look a little lower than they actually are, because we do have lots of children that see healthcare providers in Indiana. So that might be one good outcome of the pandemic, is that there's more crosstalk between those systems, and that's being worked on. So that's more of a longer term fix. We're working on what that shorter term data entry might be. And then in terms of the vaccine required, so I do believe that with businesses and universities, they can require the vaccine. I don't know that there can be public policy that requires the vaccine while it's under emergency use authorization. So like some of the colleges that are requiring it, it's not blanket for all students, but it's to live in the dorms, for example. So in certain high risk situations that you could opt out of if you don't want the vaccine. Yesterday when we did a Facebook Live with Lauren Hamill, I know he stated the hospital is not the health system is not at this time thinking or trying to make it a requirement, but they're definitely watching others and if other health systems are doing that and what that impact is.
Dr. McConnell.
Yeah, those are good questions, Joe. The requirement question is going to be one of the big. Nikki and I were just talking about that last week at a meeting, and that's going to come up now all over the place. And lawyers are going to have a great time because there's going to be lots of people saying, I'm not going to get it, and I don't care what my employer says. And that's going to be a incredibly hot topic. If I might, just to say that part of the thing to Joe's point about, people are a little trying to figure out what the latest rule is, especially when you're tired of all the rules, is really, really hard. The latest order coming out saying that only 20 people can be together in 1,000 square foot in an outdoor venue like a fair or things like that. That means everybody's got to be 6 feet apart. Just the orders that came out yesterday, a couple of them conflict. And if you're fully vaccinated, can you go to the art fair on the bluff and be within 4 feet of somebody? Can you walk alongside of your wife? And what does that mean to people who are looking and saying how terrible the compliance is? So that's going to be a really, that's really dicey to try to figure out what's actually going on. But I agree with Nikki. I think the majority of people in our community have been relatively pretty compliant. if I could just say a couple of things, just to comment on what Nick said about in terms of number of cases and the surge that happened in Michigan. So our number of cases now have really, in the state of Michigan, now approach what all our surrounding 5 states are like. We were down in number of cases. We weren't in deaths, we're actually higher in deaths per population. But in terms of number of cases, the surge we had in certain areas, like in the thumb, have now brought us into the same realm in terms of number of cases per population in other places. So we had some susceptible pockets of population that probably accounts for what actually happened, especially as some of those areas unmasked or loosened up or whatever. So, or just it was the bad luck of that it happened there. So that's really happened. In terms of a really good piece of news is just came out in a big study yesterday. It looked at people who were sick with COVID a year ago and how is their antibody immunity doing. And of the people, 3/4 of them were people who were outpatient and 1/4 were inpatients, and both of them had great immunity antibody level later, almost all of them, and every one of the people who was hospitalized had great immunity level, antibody level. And we've already known that cell-mediated, the other side of immunity, cell-mediated immunity has gone well beyond 6 months. So both of those are really, really good news for, if you've had it, and the odds are your immunity is lasting long. Every time they look now, it's lasting longer and longer. So that's very, very good news. I would say a word about schools. Schools, to me, and I applaud Nikki for her tireless work and working on a state committee for that, and our superintendents for we're probably the most in-school county there is, and other counties call us up and help the medical directors. How are you doing that? It's been a lot of work. But when we look at what percentage of the kids that are quarantined that end up sick and we might have had an outbreak, it's down to 1 to 2% is about all we can attribute to spread in the schools. And actually, for most of those, there are other alternative explanations that you could accept, like they were over their friend's house for an evening or whatever. A friend of mine is a pediatrician, medical director of about 6 or 7 counties up in Traverse City and whatever, and they have the same school numbers that we do of maybe 1 to 2% of kids that are quarantined actually end up having something. So that's very good. So schools remain low. In terms of the school testing plan this spring for sports, plan that I disagree with, but our schools are doing it. And for instance, Lakeshore, almost every Sunday evening, they test about 250 to 300 kids who they get a weekly test to play a spring sport. And almost every Sunday, it's 1 or 2 or 3 kids that turn up positive. And so we just haven't seen anything dramatic in that way. That's true of the other schools also. I find some of the school sports rules, as do some of the athletic directors I talked to, hilarious. I mean, it started way back in basketball. It was unsafe to have a jump ball. You couldn't get together because there were too many people close together. So it was just a side out. But then during the rest of the game, people are running around covering each other man to man or woman to woman. Pretty hilarious. And now in the new order, so baseball players can go out into the outfield, and softball players can now go out and stand out in right field without a mask or behind home plate or whatever. That's a new order that just came out yesterday. In the dugout, you're required to be X number of feet and masked. I hope there's not a bad rainstorm since the dugout doesn't fit everybody. But anyway, that's sort of what's going on with schools. And in the treatment note, there's another really, so some of the antibody treatments with variants, there's a question about whether they'll become a little less effective. There's a new monoclonal antibody treatment developed by Lilly, which holds great promise, and it covers every one of the variants to date. And I can't understate the fact that every virus that's, has some similarities to this, whether it be the RSV virus, the flu virus, even HIV, undergo mutations that, generally speaking, do not make for dramatic change. The treatments for HIV, for instance, even though there's been lots of mutations, are still the same and effective against them. And so far with all the variants, there hasn't been a failure of any of the vaccines to prevent people from getting, sick and hospitalized and dying. So that's all good news, and I think it's good to hear some good news. And that's what I had to say. Thanks.
Good. Dr. McBride, did you still have a comment?
Yes. Well, I agree, Nikki. You said that there's a fairly large population that if we got the vaccine to them might get vaccinated. So what are our plans to get the vaccine to centers of population that might be willing, if they had the vaccine, where they work, where they play, where they shop?
Yeah, that's great. And Courtney, chime in at any point, but to get started. So one thing we've been doing is we've actually started to move towards very consistent hours and times that we have a clinic at our health department. And we know our health department location is not accessible for everybody. So that only gets at people who just want to know what day and time can I show up and I'll fit it in. So we're working towards that consistency. But we're also continuing to just try to go to less traditional locations deeper in the community. We have been, I think of many of our health department partners, I think we've gone to like 85 to 100 clinics outside of our health department. Some of those have been in repeat places, but we have definitely gone to where people are throughout the course of this, which I think is why we got such good saturation in our older adults so quickly. But it's definitely working through that. However, to whatever scale we can take the communication strategy we talked about with those grant applications, with our resolutions, and having more nuanced communication. Jillian is trying to work through what having a little bit more segmented communication looks like, because mass messages work for the vaccine motivated people and even some of the vaccine convenient. But as you get further on that continuum towards people that don't want the vaccine, we really need to be using different theoretical frameworks for how we communicate with people and making sure that we're using language that fits the appropriate subculture and that frames and honors the questions that people have too. So that is a lot of work. We're trying to figure out how we can bring resources to bear to that. We're also not the only county that has that, and we don't necessarily have very unique situations people are living in opinion. So trying to figure out how we can leverage state resources as well as other local health departments to do some of that message framing. I mean, frankly, we need to be doing market research and testing some of those, some of that communication to see how it hits and lands. But a piece that we didn't mention in talking about those grant applications is in concert with trying to do outreach with vaccine ambassadors and canvassing neighborhoods. Two things. One, we want that to be bi-directional communication, where we're hearing from the communities what they want, what they need, where we should be. And then the second piece is there's some timing there of, as that's happening in a specific community, we also are going to have conveniently located and scheduled clinics available so that we can pair a decision with an opportunity to be vaccinated. It won't always be instantaneous, but we're trying to make that work. There's obviously a lot of logistics that go into that. Those are not going to be high throughput clinics where we're getting out hundreds and hundreds of doses, but we need to go more to that hand-to-hand, more one-on-one interventions to be able to target those groups. Courtney or Jillian, what would you add?
That's a good summary. I think the shift is, I mean, our whole strategy the whole time has been, you know, where are familiar, trusted community places to be, and that's where we've been and working with those partners. I think the added layer to it now is, okay, and when are the convenient times people are there? So we were always in those community places, but our goal was that like mass vaccine. So we had the luxury of, even if it isn't a church time or an event time or a time I get my groceries, like people will come to that location because they know it. Now we just need to shift that and be there when they're already there, because someone, again, as Nikki said, is not going to go out of their way. And so with that, we're trying to do a little bit of analysis, same on the communication side, but even in our clinics. So when someone registers for an appointment, how likely are they to keep it? We've always had a little bit of a no-show rate for various reasons, but it's been pretty small. We've now entered into this area of, well, I scheduled an appointment, but if something else comes up, I might not go to that one, or I might go somewhere else. So trying to understand that, trying to understand our walk-in capabilities and what else we need, even when we're on site, to say, hey, we're here today, stop in. So we're kind of working through a lot of that to understand what we need from a staffing perspective, because I think there's some opportunity, and we've talked about how do we make more concise, small field teams so that we can be at more of these sites, right? There's a lot of areas in our community where people are regularly. How do we best use our staff that if we're doing 20 vaccines, we're staffing it for 20 and we can be somewhere else to maybe get 30 vaccines at the same time. So we're just trying to kind of be in that dance. And we're in about a 2-week period right now where we're kind of finishing out some second doses of our first or whatever phase of that strategy we were in. So we still have a couple of those mass clinics left, if you will, just to get those second doses, but able to kind of play with our schedule of, okay, what store is a really good place? And to Nikki's point about Tuesdays, one, it's that dependable, always have that, but it's also a counterpart to events. So we've talked about what summer events can we be set up at? Those will not always be appropriate to only offer J&J. Like some of those events, we might need to have Moderna or Pfizer, but because of the nature of events, you don't have a second event. So we need to have a home base for someone to be able to get that second dose. So we're trying to think about our schedule in a way where we have days where we can be out, we can go to that special event, we can go set up at that store, but then we have some consistency to say, here's where we can get someone their second dose, where we can say every Tuesday evening or every Wednesday evening, whatever that is. So there's a little bit of a dance in that too, if we want to be at the event, but we have to make sure we're pairing a first and a second dose. We're also thinking through what it looks like to have vaccine options. We've pretty much at this point had a clinic that's Moderna, a clinic that's Pfizer, a clinic that's J&J. Sometimes to use vaccine and not waste it, we've had a little bit of an overlap, but nothing where it's, you know, a full clinic where you can be in a Moderna line or a J&J line. So we're really trying to think out the logistics of that as well, because if we're going to the vaccine convenient, I don't want the convenient to say, great, I would have gotten it today, but that's really not the product I want. And we are a bit in the landscape now where you have the luxury. Before it was like, take what's available to you. There's a bit of a luxury now where people can say, no, that's not the product I want for whatever reason that might be. So I think we need to kind of think about how do we accommodate that desire in our clinics too. So we're working through all of those. Of course, offsite makes that a bit more complicated because we still have to keep vaccine refrigerated or frozen. But we've also gotten really good at that. Donna and Candy and team are great at being able to think through those aspects. So we're working through all of that right now for summer.
I'm impressed how well you've thought this through. Thank you.
Yeah.
We have demographics on the unvaccinated. I don't know if you can even get that from your data, like location or age or anything where you can focus on certain groups.
Yeah, we do. Fortunately, there was a tool that it was made available to health departments in February that shows that, and we can actually, at the census tract level, get the percentage of people that have been vaccinated in different age categories. There's race breakdown. Now, the caveat with the race breakdown is it's not perfect data because a lot of providers hadn't entered that data. In the beginning, there were issues with capturing that in January and February. I think all of that has been resolved. But yes, we are drilling down deeper. And what we're finding, I mean, is that yes, in Niles and in Baton Harbor, we have some census tracts with lower vaccination rates, but absolutely in our more rural census tracts, we have lower vaccination rates as well.
Okay. Dr. Edwards, you were...
Yeah, I've got a couple of points. One is, again, what I hear virtually every day in my office, which is a reluctance to get the vaccine because of concerns about side effects, et cetera. I read today in Herald Palladium the weekly report of our number of cases, and I think it's important that we start to figure out a mechanism to report out adverse reactions to the vaccine because it's very rare. And I think that can only help us reinforce the safety of the vaccine. The second thing is that I would say many people are not aware of the Michigan stepwise approach to the vaccination, basically tying vaccination numbers to more societal freedoms. It could be argued that at a time where we've done things very scientifically, I think a lot of people could argue that it's very difficult to show evidence-based statistics for this policy, particularly when states like Illinois, which have been very strict, just like we have, are basically talking about just opening up en masse on the 4th of July. So we're going to have increasing challenges of communication. The third is that obviously the number of cases as reflected in Nikki and Lauren's discussion yesterday is trending younger. And I think it's very important that we continue to emphasize that as we try to convince younger people to avail themselves to the vaccine. But we need to have a little more, I think it's very challenging because we have to change our message a little bit. This isn't as a blunted instrument any longer. It has to be much more surgical in our approach. Thanks.
All
And
right.
Nikki, Bob Harrison, I'm still hearing from the younger people that this is a disease that only affects the elderly, and that everybody in the hospital is over 65. And so I think, my assumption, and I've not seen any data, is that some of the hospitalizations are people less than the age of 30. Because I mean, the 19, 20, 22-year-olds think that they're just going to get it like a mild case of the flu or a bad cold, and that there's no real personal risk. And one suggestion might be that if indeed the facts show that there are young people being admitted with very serious illnesses, that information gets pushed out as part of our selling job to get the young people, vaccinated. They're seizing on all these, single adverse reactions and somewhere distant, and pointing to the fact that, they don't want to get paralyzed. They don't want to have blood clots, and they're missing the whole boat that that's such an isolated event that there's other people ending up in the hospital with bad, pulmonary or respiratory issues. So just a suggestion of a tactical change in how we're messaging.
This is Johansson. So that's a hard one. It's an interesting point, Bob, but it is hard to argue. Although I am for the vaccination for all the people, the fact remains is it doesn't really hit younger people hard. And although there are people in the hospital that are younger who have a positive test, they're all tested when they go in. So they may be in for something totally different and they end up with a positive test. Our deaths, like other places, still remain. Our average age of death is 83. The number of people that we've had that have died below the age of 60 is very, very few. And they've been people with very, very significant comorbidities. The state of Michigan basically refuses to release the information about the number of child deaths because of a confidentiality issue, because there's so few. And that's the under 18 crowd. It's less than 10 in the nation. The thing most troubling for kids was this MIS-C disease, the multi-system inflammatory COVID. In the whole entire United States, now in 17 months, there have been 24 deaths. And of the 24 deaths, 23 of them had significant multiple other comorbidities. So if you try to argue about how seriously your chance is of having a terrible outcome when you're young, that is a hard message to support. It was a lot easier to say by you getting the vaccine, you're protecting the others around you. But to say you as a 24-year-old, that's a hard one. And people know
Rick,
that.
Rick, how about the long hauler consequence of people that have had the disease? One argument I hear in my office every day is, and one of the things that keeps people from getting immunized is, I already had COVID, so I'm immune, and so I don't need to get the vaccine. The emergence of the long hauler and the consequence of getting this disease are much more pronounced than just a very serious illness that gets you hospitalized.
Yeah, so that
Dr. J, you are muted.
Okay, so the long hauler phenomenon is, so most long haulers, it is thought by most of the, in my opinion, some of the better thinkers are people, it's a mental, psychological anxiety, issue for the majority, but there definitely are long haulers who have prolonged respiratory issues, et cetera, et cetera. And some of them are young. So that, yes, that is an argument that University of Chicago, for instance, has a clinic just studying long haulers. I have a family who, a 30-year-old woman is at that, and she appears to be a respiratory long hauler. So those happen. They're probably not that frequent, however, but that is an argument, Ken. You're right.
All right.
Did that help, Ken?
So just to keep I know we've had a lot of questions, but just to keep moving, thank you for the COVID update. May we move on to the medical director position, Nikki?
Yes, so we have convened a 7-person interview committee, most of whom is here on this call right now. But just as a reminder to the board, we solicited applications from medical director candidates until April 15th. The committee is comprised of Peg and Dr. Edwards representing the Board of Health, Commissioner Harrison representing the Board of Commissioners, Courtney, Candy, and myself representing Health Department staff, and Shelley Jasper from County HR. So the 7 of us agreed to interviews with 3 candidates. We have held those initial interviews and have worked to narrow the candidate pool so that we can move to a second round of interviews. Those interviews will be taking place on this Friday and engage more staff members. So I'm hopeful that within the next week or so that we will have potentially identified our candidate and be able to start the contracting process. We are the clock is ticking here, the calendar and the days continue to go. So it's May 5th. We know that Dr. Johansson had his end date, about the end of May. So we're working to make sure that we can get things in place in it so that we have an orderly transition. I'm confident we'll be able to do so.
Thank you. Dr. J, anything additional from what you spoke of?
No, I'm fine. Thank you.
Well, that's thank you for everything. So, all right, Dr. Harrison, do you have a reflection from the Board of Commissioners?
Sure. Right now, the big issue, one of the big issues that we're dealing with, it relates to Marion Bus and the status of the county as a transportation provider. Some of you might not be aware that TMI, the company that we had hired to manage Marion Bus, went out of business during COVID. And so it's created some significant issues for us. So we're in the midst of discussions with several local units of government regarding transitioning Marion Bus to another provider. There has been a consolidation in the Niles Buchanan market where Niles is going to operate the Buchanan dial-a-ride. So we see that as a positive development. And then there's a number of discussions going on. It's interesting, much like with other things related to COVID, there's been more money pushed out into public transit by the federal government. And because ridership has plummeted significantly. And then we're forced to do a lot of the same mitigation issues and practices that other providers are. So it's a very fluid one. We're still pushing forward on trying to make sense out of public transportation in Marion County. And then the other initiatives, spending the money and broadband and that, no real big change. We're just continuing to push forward on those. I'd be glad to answer any questions you might have. This is road construction season, and so that's a problem for everyone. And I apologize in advance if we're not sensitive to your local area's needs regarding road repair or resurfacing or the variety of other issues.
Just get that bus service up and running. That's the critical thing for public health. Yeah.
It is a real problem, and I'm not sure there is a simple solution in front of us.
Yeah. Thank you so much.
So there's not going to be a subway?
Not in my lifetime, and definitely not in your lifetime. So there you go.
Thank you.
I wanted an elevator train myself.
That's great. Yeah, go ahead and send that in to the
Sure.
county board. Yeah, we'll give it the consideration it's due.
All right. Any board discussion that you would like to have? Jillian, are there any?
Sorry.
Yeah, yes,
Sorry.
Vanessa.
I did have a couple of questions. Recently, not just recently, but for a while, there's been an uptick in the gun violence in the community. And as the health department, I feel that we should be doing something to address that, especially around the Highland projects. It seems like a lot of the shooting and death comes from that particular area. And I just don't think that there's nothing that can be done to address that. And I think we need to, as a health department, look at what we can do to help alleviate some of that. Some grants or something. I know you're kind of swamped right now, but I think that that's something that we should be exploring. It's a very bad problem.
Mm-hmm. Yeah.
It is a public health problem. APHA has said gun violence is a core public health problem.
You know, this is very interesting. I serve on a trauma committee in the hospital, and you know, Vanessa, you're hitting the ball out of the park here. We look at case after case after case of escalating gunshot wounds to our patients that we're caring for. And we're always bewildered at the lack of easily accessible information about the number of these incidents. And I think the first aspect of this is to increase public awareness just of how serious this problem is. We're seeing the greatest rate of gunshot wounds medically in my 27-year career. And you're seeing something that is underreported. And I think part of the public health department's mission probably is to at least highlight threats to public health. And so I think this is worth discussing and maybe keeping as an open opportunity as we move forward.
I think there's some corollary damages as well. We're out here on Pawpaw Lake, but people that I talk with, they avoid the Napier Avenue Mall area like the plague. Because of they do hear about the violence. The roads are poor. The violence and the storefronts that are empty, and they just go to South Haven, Kalamazoo, or South Bend. And so I think it hurts economically. It creates job loss, just a lot of corollary damage as a result of what's going on.
What if we talk about violence as a public health issue? I mean, it's already been discussed on a national level. Why do we not take that up as a county?
So I totally agree with all the comments that have been made. I'm really cognizant of the exhaustion of the staff. The staff has been going full speed ahead since September. We still have a big hump ahead of us. Is there any way? I don't want to minimize what you've said, because I know it's any of you have said, but I'm just concerned about another initiative right now when everybody's exhausted. So
well, I don't think it has to be necessarily immediate, but I think that having that on the radar for us as we move further through sort of the epidemic, hopefully aftermath. If we don't have it on our list, or we don't end up putting energy to it, nothing will ever happen. So
we might be able to start just with a reporting of incidents. How many gunshot wounds per month? How many gunshot wounds per quarter? As we emerge from the COVID initiatives and we start looking at other public health issues, we aren't going to solve the problem of gunshot violence in our county. But we can work on some ways that may be not overly taxing for our staff to be able to at least report it. And with awareness comes coordination of action.
From I suppose a law enforcement perspective, I mean, they're as astounded as I think we all are about the incidence of gun violence. So I get not every day, but every couple of days a report. And what is shocking to me is the number of guns fired primarily in Benton Harbor and Benton Township, where no one actually gets hit. I've always been mystified about the house shootings that are going on and the cars being shot up. I know there's parties that take place in parking lots on the weekends and during the week, depending on the weather. And a lot of those are linked to gun violence later on, where disputes might erupt from people attending those parties. So we are also, City of Benton Harbor and Benton Township are seeing attrition of their law enforcement officers for other communities. And so the Marion County Sheriff's Department and Michigan State Police are supplementing law enforcement efforts in those primarily in those two areas. There's also been an increase in the number of pursuits for whatever reason, stolen cars and the like, not just in our communities throughout Marion County, but also in northern Indiana. So what we're seeing isn't unique to Marion County, but is also going on in Kalamazoo, Grand Rapids, and other Midwestern communities. And some people are pointing to excess cash being pushed out to maintain the economy by the state and federal government, so people don't have to work and can stay out late, party all night, and no job obligation in the next morning. And so it's so multifactorial that I'm not sure there's any single thing that's going to fix this in the short run.
what about the number of gun licenses that are being, gun permits that are being awarded or gotten?
Most of the guns being used are not legally purchased.
Well, but what about, I understand that, but what about the number of gun licenses and guns that are being sold in the county? I mean, it's not necessarily a Benton Harbor only issue.
Oh, no, not at all. And I don't mean to characterize that, but a lot of it comes from the drug trade moving between Detroit and Chicago. And so there's really no limit on access to weapons. It's just not that hard to have happen.
So if I could just chime in here. So I think that it would behoove us to be thinking about gun violence as a symptom of broader public health issues and broader themes and struggles that people are going through. So I definitely hear everything that you all are saying. And I think as public health professionals, we share a lot of the concerns. We understand gun violence as a public health issue, but to focus on the violence and the law enforcement end of things and in missing all of the upstream determinants of how we got there would be a bit remiss. So some of the ways that our department has been trying to build capacity to then start to address this, because unfortunately this is not new. And there has been some work that several of our staff members have been part of for a few years prior to COVID, trying to address issues of gun violence. But a lot of it has to do with substance use disorder, mental health, But then even further upstream, we know there's a lot of protective factors in communities that reduce the burden of mental health and substance use disorder. And a lot of that has to do with economic opportunity, housing stability, education levels. So there's a lot of protective factors that are missing in communities and pockets of our population where gun violence is more common. And by focusing on the gun violence while not having that broader perspective of how do we bring those protective factors in place. And I know nobody here was saying that. I think this it's good, and it contributes to some of the senior leadership team discussions that we're trying to have and finding the bandwidth to have about what does our health department look like post-COVID, knowing that this is another area that has been really escalate. The issues have escalated and rapidly grown, likely due to some of the COVID-19 mitigation mitigation measures that were put in place. So as we think about who we're going to be on the other side of this and what our service line portfolio looks like, those issues are certainly top of mind. And to Vanessa's point, I mean, it does take resources to be able to try to address some of those issues as well. So not saying we can't do anything with the lack of a specific grant or specific funding, but we have to think a lot more broadly and a lot more holistic.
Well,
I agree everything that Nikki just. I agree with what Nikki just said, but I'd like to add that just one program. We've been working on this. One program is Nurse Family Partnership, which we started in 2000 against the wishes of the Michigan Department of Health and Human Services, or whatever it was called then. But the biggest support we got was from Michigan State Police. In fact, because studies have shown and continue to show, and I'm on their state board and just looked at data recently, that like Nurse Family Partnership, the offspring of the children of the families you first start to work with are so much less likely to be involved with law enforcement, juvenile delinquency, and all the other issues. That's just one of the things that we've done that, you know, have been working at addressing this and continue to.
Yes, I believe that Dr. Edwards made a point. For one, we need to have the statistics of what's going on where, and then that we can gauge from there if it's getting better, worse. But there's many things that can be done that doesn't cost a lot of money. Like I saw on the website where the police department was having a sale of things that had been confiscated. And I was just surprised to see that in one of those sales, they were going to sell back guns. I think if a gun is confiscated, that's a simple thing that can be done. It just needs to be melted down, you know, and gotten rid of. But we have to look at, yes, the poverty and all of those issues, but there are other things that can be done to help alleviate this. But we need to look at this seriously and try to do something about it.
I'm going to go ahead, finish your sentence, Vanessa. I'm going to have to gavel this down, but please finish your sentence.
I'm done.
Okay, so we hear you, and so we'll look to the staff to talk about those preventative health factors at a meeting in the future. So thank you very much. Jillian, are there any public comments that we need to address?
There are no public comments.
No public comments. All right. Well, thank you all. We stand adjourned, and our next meeting is June 2nd. Thank you.